The Trump administration's attempts to modify recommendations for COVID vaccines and implement changes at the CDC have encountered a legal obstacle. 6 groups representing pediatricians, physicians, healthcare professionals, and pregnant women have filed a lawsuit against the Department of Health and Human Services, HHS, and HHS Secretary RFK Jr. for taking unlawful and unilateral actions. Well, here to set us straight on the case, now before the U.S. District Court in Massachusetts, is Katy Tolento. She's Executive Director of the Alliance of Healthcare Sharing Ministries. Katy, please remind our audience, what did Secretary Kennedy do that led to this lawsuit?
Well, first of all, he fired the entire advisory committee on immunization practices, which had led us so astray during the COVID pandemic, and replaced them with sane people from all different categories of on the continuum of vaccine skepticism. And then he also recently, the FDA came out and said, hey, we're not going to recommend that the COVID vaccine be given to all healthy children and every 17-year-old boy and, 6-month-old babies. We're only going to recommend it be given to certain subpopulations that are highest risk health-wise. So this has got the medical establishment all in a tizzy, and for all the right reasons.
Well, the plaintiffs in this case are seeking an injunction against RFK's orders. So what would a stay from the court blocking the HHS change mean for parental rights?
Yeah, it really is a threat to parental rights because this advisory committee on immunization practices actually dictates what happens to children in schools across the country. 36 states defer explicitly in their statutes to this advisory committee or the CDC. And so to the extent that this advisory committee is allowed to continue using its anti-science dogma and ideology to drive vaccine policy, mandates on school children, violating their parental rights and their parents' judgments and medical decisions of their own healthcare providers chosen by the family, that is all out the window. And these parents have very little recourse in some states, and especially if they're not objecting or wanting a different schedule for their children because of religious reasons, they almost have no recourse in any state.
Well, here's what Secretary Kennedy and FDA Commissioner Dr. Marty Makary said about the COVID vaccine order at the end of May.
I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
So, Katy, why the outrage over this? Is it about protecting children's health or money?
I think it's actually about money. You've landed right on it. So what happens is these pediatricians, they get paid by insurers at the end of the year a bonus based on how much of their population is fully adherent to the CDC schedule, meaning they can get hundreds of thousands of dollars, sometimes more than their salaries, in these bonuses if their entire patient population is vaccinated according to the schedule. That's why so many, almost all pediatricians and pediatric practices will fire you as a patient if you want to not comply fully or delay or have a different approach to vaccination. It's really driven by the money. And these are the same people who have shown over and over again not to have good scientific judgment. They created peanut allergy epidemic in the United States that no other country has because of their bad anti-science recommendations. These are the people, the American Academy of Pediatrics came out during the COVID pandemic and said, actually, lockdowns are terrible for kids, for school kids. And then they were pressured by Dr. Fauci and his ilk, and they retracted that. So, these are ideologues and they're anti-science and they're incompetent at best.
A lot of this is now coming out, and I know RFK Jr. has been labeled as anti-vax, and that's something he's denied repeatedly. However, there seems to be real fears here, Katy, that this could lead to many parents refusing to get their children other vaccines that are actually effective in preventing many childhood diseases. Your thoughts on that?
Well, we don't actually know if they're actually effective. If you look at something like the hepatitis B vaccine, which is given to every baby on the first day of life in the hospital, that was followed for 5 days before being approved by the FDA, that vaccine. We have absolutely no science around whether the entire childhood schedule contributes to or worsens health for children compared to not being vaccinated or a delayed schedule. That science has never been funded and it's never been done. So what we have is we have very short improper studies being done on one-off vaccines before they're approved. They're pushed out by this advisory committee and by the CDC, and parents are told that they're safe and effective, just like we were on the COVID vaccine. And we really don't know if that's true. And there's a lot of evidence to suggest that it's not true. So I don't think being anti-vax in this day and age is actually anti-science.
Well, it's good to be skeptical, and I'm not a lawyer, but many people likely believe that RFK Jr. and President Trump have the legal authority and the right to make changes to executive branch departments and their orders. Do they not?
No, they absolutely do. The creation of this advisory committee and the people who are appointed to it and the vaccine schedule itself are not subject to the Administrative Procedures Act because they are not regulatory. These are executive decisions that can be implemented by the secretary or the president at will.
Okay. Like many other Trump administration orders, this one may likely go all the way to the Supreme Court. Katy Tolento, Executive Director of the Alliance of Healthcare Sharing Ministries. Thank you, Katy. Good talking to you again, and thank you for setting us straight today.
My pleasure. Thank you.